You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We have Dr. Jenna Carl with us from Los Angeles, California, and we're going to share some good insights about what it means to be a psychologist in this world. How are you?
I'm doing great, Dr. Franku. Thank you for having me.
Absolutely. Jenna, can you take us back a little bit of your beginnings? How did you start this journey? What it means for you, and where are you now?
Yeah, absolutely. I had a little bit of an unconventional journey here, which many of us have had. Ultimately, I was very attracted to and interested in psychology in college. I think it's actually a pretty fascinating field for most people. So psychology is one of the most popular areas of courses in college. That wasn't unique. But I did not go into psychology after college. I instead worked in government and worked in consulting, and found that I just was missing a feeling of like making a real impact on, direct humans right in front of me, and kept thinking about psychology and the ability as a therapist to really work directly with people and making improvements. And I would say at the same time, I was also learning, and there was more sort of like coming up probably around behavioral approaches to improving mental health and well-being. And that really caught my attention. I think it was really interesting to think about, that you can actually make biological changes through behavior change. And so thinking it's not just medications that people can use, and that it's really empowering to actually use learning and behavioral skills as a way of making real, genuine health improvements. And so it was kind of thinking about that I finally decided I was ready to commit to the long path of becoming, trained and licensed as a clinician. Whatever degree you pick, like most of them are quite a commitment. And so I picked, a clinical psychology PhD that was like a scientist practitioner training. So it was both being a clinician and also being a researcher. And the 10 years later, with years, a couple of years of doing research plus the training program, I was very pleased with. I came out with that background, that degree, but it took me a while to be ready to make the commitment.
Interesting. This is a great field, especially for medicine. And I want to touch on a subject that's kind of important in the same thing, very touchy. The fact that a lot of medical professionals, doctors, and healthcare workers do not believe in psychology treatments for themselves. It's very rare you're gonna see one of them going and look for help. And there's several areas in healthcare that a lot of people are burned out, and they get to a point where they're saturated mentally with the burden of their work every day, and they don't know what to do. What do you think is, in your opinion, the biggest issue with this specific field of work in healthcare?
Mm-hmm. Yeah,
from the psychology point of view, obviously.
Yeah. I do think longevity is one of them. Like, I think and I don't know if it's not unique to psychology, as you say. Like, burnout is just such a real issue in health, in direct healthcare practice in general. I would say psychologists who do one-to-one therapy, it's particularly acute because it's very intensive emotional work. And you are dealing with not only the intensity of that type of relating and connecting with a person in general, but you're also often dealing with issues around trauma and, it's very significant and unsettling content areas. And so between the intensity of the process and the intensity of the content, I think, for therapy and mental health care is just particularly challenging from a clinician burnout, perspective. And so I think that is kind of to your point why, like, many psychologists are looking for ways to extend and expand what they do beyond of just that direct care. And I think that can lend to a really, really much more rewarding type of professional experience when you have a more mixed set of activities you're doing, which might include some direct care, but also like you're supplementing with other types of work and innovation.
Yeah. So let's go back to your career and your journey. What do you think success means to you?
It's a good question. Um, I suppose I think of a few different dimensions around success. And so for me, one of those is having an impact in areas that I value. And so, that is certainly feeling like I'm really genuinely helping people improve themselves and their lives. And so that's very in line with the impact I want to have. Separately, though, it's also about like having an satisfying and intellectually like engaging career, and like, which is like opportunities for learning and professional growth that, kind of continue throughout the career. And I think more, and then broadly than that, it's also just as a career, supports my family. And so thinking about my own ability to have a career that continues to be supportive of my general lifestyle and family's needs and things like that.
Yeah, interesting.
Yeah.
Um, you know, obviously you got to this point in your career that you are exploring different avenues of practicing. And I want to know if there was any moment so far where you experienced any kind of setbacks, um, failures, things that didn't go your way, and kind of move you forward even bigger.
That's a great question. And yeah, my heart started beating faster as I started thinking about it. Yeah, I certainly have it. I'm sure I've had many, but as I was thinking while you asked, there was one that jumped out as, sort of maybe more formative in my trajectory. And that was that I had a lot of different options for my postdoctoral fellowship work. And it was a hard decision, but I ended up picking, making a choice that then it was a hard decision. I was very excited about my choice. And then unfortunately, maybe only 4 months into that new postdoc, it turned out to really just be not at all a good fit for me. And I was so stressed, it was because I felt like, if I left or quit, it would be a sign of failure. And like, what would it do to my career? Because there was no, once you start those regimented training programs, they start in August and they end in July. And when I was, in December needing something different, like there's nothing else you can go into. And so I was just very worried about the implications of that. And I eventually decided that the situation I was in was too much of not a good fit and too stressful, that I was just going to have to leave and figure it out. And so I did. And I, of course, as people often find in those situations, I was able to rally many supporters and many advisors, and I did end up finding a transition that was really wonderful. And I learned a lot of things that I didn't expect to learn. It was not what I planned in any way, but it still got me to where I needed to be. So I think that's an example. It was very hard, but it ended up working out. And in the end, I'm sure that it was better that I made a change than stayed.
Nice. What kind of path that created for you? Did that help you in what you're doing right now?
It did, actually. So the only option I could sort of figure out in the middle of this year was to just begin starting a private practice for myself, although I wasn't fully licensed yet, so I did need a supervisor to assist. But I'd never built a practice before, and I was, early in my training, and I just figured it out, right? And so I was able to figure out, well, actually prove to myself that I can learn business operational, pieces of the work that weren't things I was trained in. And so I showed myself that I could learn and do the business side of a practice which I hadn't done before. I figured out how to do marketing activities. And I figured out, and I realized that I could actually build and support myself, and do a lot that was very interesting in just building a practice. And then that led that ultimately I didn't stay in that career line. I've continued to have a small private practice my entire career, but I jumped into working in a health tech company that was very early stage, but it was the same, the sort of entrepreneurial learnings and spirit of being able to kind of like cross lanes and realize that just because I'm a clinician doesn't mean I also can't be effective in these other types of work. That was very helpful. So it just helped me be very comfortable sort of moving across different areas of work and try to trust myself more.
Yes, I think hardships in general, gives you a satisfaction when you do the right thing, especially for yourself. And psychology is one of those fields that it's usually a private practice. It's usually a solo private practice. And you guys do a lot of work with a lot of people, but you also have to do a work for yourself, for your business. And what do you think the mindset needs to be there for people like yourself? Because it's not easy to go on and on doing clinical work with patients, and in the same time thinking in the back of your head, what are my business implications if I work 8 or 10 hours or 12 hours a day. um, there has to be something that you think at that moment. What do you think the patterns are in your mindset to do that?
Well, I do think that kind of to what you're alluding, unfortunately, even though it is very common for psychologists to have their own practices, that's the only part that you're not at all trained on or specifically prepared for. And so as a result, I think a lot of psychologists feel unconfident about some of the areas of kind of running the business of their practice, or may just be, call it sub-optimized in how they're running their business. And so while it's true that generally you need, if you're only relying on patient care to expand your business, then you do need to see a good volume of patients. There are certainly other ways of expanding your business and so that might include hiring staff that you're overseeing to provide care, or it could include building other other aspects of the business as well that are not just direct care. But I think those things you don't see as often because they are a little bit more advanced or one step further into this, needing comfort in building a business, running a business, being creative, trying things out. And so I would love to encourage psychologists to lean into some of those areas and realize that they actually can do a lot and make their practices more varied and more rich. And it doesn't have to be the sort of standard, just scale your own one-on-one therapy with clients, because that is really hard to do over years and years and years.
Yeah. Do you think there's any specific trait or routine or habit that someone like you needs to have in order to be this proficient clinician and in the same time, a successful entrepreneur with their practice? What do you think the traits need to be? What do you advise someone to do in order to be successful in that?
Yeah, that's a good question. I mean, there's clearly people that are just more comfortable taking risk, right? In basic psychology, that's one of the main dimensions is, call it neuroticism or anxiety, but some people are just more comfortable taking risks and others are more anxious. And so that's one thing I think that you see a lot of therapists, I think actually are more risk averse, and that can make it harder because ultimately with building a business, you are taking risk. That is just the case. And so I think, so then I think you could do work around that, growth mindset type work around, well, what is it, what's the value in taking risks, and how bad is it if you fail, and doing more to kind of work on your own psychology about that fear of risks. I think that's one thing. I think the other is that there's probably a lot that could be learned from literature around startups and entrepreneurs, because I think people really can learn some of those skills. And so then this is now an area that I've spent a long time in my career within a health tech company. But I think you think about how you take risks in different ways, in a different way than you might otherwise. So for example, we have this concept minimally viable product in startups. And what that means is you never in a business context want to spend a lot of time building something to perfection before you release it to your potential customer, because you might just not get it right. And then you spent all that time and resource doing it before they've seen it. That is what a psychologist or, academic that's not trained in, more of a startup mentality, that is their instinct, is oh, I want this to be really good before anyone sees it, which is the opposite of the recommendation. And so what I would say is help psychologists understand what you want to do is test out a lot of different things in the lightest resource way possible and see what you get and see what you learn. And so think about how to do that such that the risks are really low and you're learning, and then you just build little by little by little. And so then you're then you're reducing that risk and you're building in a way that is less likely to backfire. So this is, it's kind of like a mix of like your personality traits plus, I think, some skills that you could have around learning to build businesses.
Yeah, definitely. You're someone who, started as a clinician, and now you're mentioning the health startup you're involved in, and this is a very risky, I would say, proposition for a lot of people. The risk of failure in those enterprises is very high.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
With what you know right now and what you've been through, when you look back at yourself a few years back, what kind of advice would you give to yourself?
Great question. I think going back, one of the key things I would have advised myself is to think really broadly about what makes you an influential leader and impactful leader. And it typically isn't being a subject matter expert. So while you start as a subject matter expert, your value as you grow over time is much more broad, and it's more about how you influence. And so, the sort of most like effective people know this very well, right? Like a lot of that is through relationships. And so you building, the right network and really strong relationships with the types of people that are going to be important for you to drive influence and impact, like that is far more valuable than many, many, many things that I could spend my time doing. But some of those things feel really odd in the beginning of your career or earlier in your career when you think, I need to be doing work. I need, I need to have like fingers on a keyboard, or like I need to be seeing a patient, and it's like, no, like actually the work is being out there and talking to people and making relationships and and that's not the only thing. There's other areas, but even cultivating like how you drive influence in in an organization or with other people, like that too. I mean, there's a lot to, I think, the skills of being effective, like an effective person. And they're very, very valuable in a professional setting. And again, they're like, it's not the things that you're sort of taught and trained in a medical profession or clinical profession.
Yeah. Let's go back to your personal career. One of the main, I would say, things that I hear from healthcare providers and doctors and all the medical professionals is that they struggle financially at the end of their career, and they struggle not in terms of money, but in terms of decision, what to do. And obviously finances have a big important role in this. How do you strategize this for yourself? How do you see yourself doing it at the end of your career, and how do you see yourself position yourself to have the best outcome out of your enterprise right now?
Yeah, that's a great question. I always liked the career of psychology because I thought it's the type that you can really generally do as long as you want. You certainly don't have to retire at 65. And I think there's a lot of flexibility. So it's a career where it can evolve over time, and you can do in later life, and you can do in different ways. And so I don't think I have a specific plan in mind for myself yet, in part just because I know myself, and I know that what I want continues to evolve. And so I guess I don't trust that I know what I'm going to want. And I certainly will say I know many, many people who intended to retire, intended to, stop their kind of primary area of work, and didn't do that or didn't want to do that when they were, in the age they'd planned to. So I'm open to the fact that I will likely continue to want to have a professional, like continued thread through like retirement age. But I certainly assume I'm also going to want to dial back and have more flexibility and things like that. So I am I am thinking about taking advantage of the periods of time in my professional life now where I have an opportunity to like have high impact roles and drive growth more quickly and, be working overtime because those are, I'm enjoying doing that now. I'm happy to do that now. And so I am sort of placing some bets now that I think, could help me have more options later. But I think aside from that, I'm just trying to kind of expand the ways in which I professionally engage. So taking on like advisory roles and other roles where I think I can imagine down the line there being different, lots of ways I can keep working that are not like full-time direct patient care. So, some mix of activities that is stimulating and engaging and, maybe provide some financial buffer, but is not, full-time, stressful type of, work.
Yeah. So I want to go back to a fundamental question that I need to ask a successful psychologist. What kind of advice would you give a healthcare professional in terms of therapy? What is therapy? What does it mean for them? And if it's worth it or not?
There are many different types of therapy. And so I think it's important to know what type of therapy is right for what any person wants or needs. And I think that this is it's very poorly known, and it's very poorly known by healthcare professionals the same way it's very poorly known by everyone else. And so if the person is struggling with a diagnosable condition like, an anxiety disorder or depression or, insomnia, bipolar, there are evidence-based guidelines for the type of therapy that you should receive in that circumstance. And for very good reason, because there are effective structured therapies that really can quickly help people to change root causes, like behavioral and cognitive causes or patterns that are maintaining those conditions. And so for those people, you should get generally what's called cognitive behavioral therapy. There's a couple other types of evidence-based therapy, but generally that's the umbrella like framework. And you want to get it from a really highly trained specialist. So that it can be very hard to find the right therapist. People often focus on aspects of personal identification, like age and race and other, lived experience. Those certainly, if those are important to you from like a trust standpoint, like that's important. But unfortunately, that is not going to necessarily get you the specialist that knows how to treat the condition you have either. So I think it's like you have to kind of balance these factors. But then there's also like, people who are looking for advice in relationship issues or like their own kind of personal growth and areas of identity development and I think then there's like a much broader set of therapists that can be helpful. It's more of like emotional support and other and even like coaching frameworks can be used. And so I think it really depends, but I'm always mostly worried that people with clinical conditions are not finding those right specialists, because I think I've seen a lot of that in my career where people come to me after 30 years of seeing therapists that have just never actually had the right training to treat their depression or insomnia. And so that patient has just continued to struggle and,
yeah.
Spends a lot of money.
I also think there is some sort of a stigma for a lot of people to look for help, and a big level of denial at some point that people refuse to accept that they need help. How do you make someone, especially in healthcare, realize that they do need help and therapy?
Yeah, it's hard when people don't see it for themselves. You can't force someone to change. So I think people, there's one set of people that are driven to therapy because they're in distress, and then there's the set of people that are driven to therapy because loved ones in their life convince them they need it.
Right.
And in the latter category, there's a lot of those people that come in sort of disbelief and wind up being complete converts, because they have such a great experience. But starting off therapy with being really skeptical is also, it doesn't necessarily set you up for success.
Yeah.
So, and it's interesting that you talk about stigma. I mean, there's certainly always been stigma, and there's, a lot of stigma around mental health. But interestingly, in my career, I have seen such a rapid reduction of stigma. Unsurprising to you or anyone else, but I mean, one of the best things the COVID pandemic did was to reduce stigma around mental health. because it spiked so high for everyone. And so it made it feel like people were less alone in having mental health issues, because we all knew that everyone else was having it too. So that's one positive, I think, is that the stigma has gone down to some extent.
Yeah. Yeah, I think there's a trend, I would say, out there for healthcare workers to look more for help, because the stress is very big on their mental health. Do you have any strategies for someone who needs help but doesn't realize it?
Yeah, I mean, you mean
to make them realize that they do need help?
I think so. A couple things I would think about are if someone is feeling like frequent stress, like if people are kind of day to day feeling really stressed, that's a very good signal that you need help. And I've talked to a lot of people who have it was that flipped the switch, where they were like, I just didn't realize that not normal to be that stressed every day at your job, or every day, and like this aspect of your routine. I didn't realize I didn't need to be stressed like that. And so I think that's one signal, if you experience a lot of stress. Another is like if you have a lot of relationship disruption, that's a big signal that you could use, you could be benefited by therapy or support. That's a sign. It's a sign of something. But if a history of relationships not working out, is it indicative of something that often can be helped in therapy? So yeah, those are two big signals. I mean, obviously then there's like more specific symptoms of other issues, like if you're feeling, low mood and, feeling really guilty or bad about yourself a lot.
Yeah.
I mean, there's so many specific areas that you could dig into more too.
What's new for you? What's coming up this year? What are you thinking about? What are you hoping for?
Great question. There's many things coming up that I'm trying to wrap my head around. So I've been in my current role maybe almost 9 years now, as a health tech leader, and I think it's been really nice to get to a point where I feel really comfortable in my role, and it's allowing me more space to really think about both are there new ways I can bring like kind of more impact to this current role, but like more sort of like outside of the box. And so that's an area that I'm kind of thinking more about. And that's kind of like what we talked about earlier, but that's, maybe is that time for me to devote to writing a book, or should I be doing more external speaking or outreach, or being on, committees focused on developing different healthcare guidelines. So there's but this like outward facing potential for me to do more. And so that's an exciting thing for me, is to think about making some space for those things, which will drive more impact in my current role, but also will be supportive of like professional growth too. Yeah, maybe that's the best way to put it. I don't know if I have anything I've settled on just yet, but I feel the opportunity to expand and add in some more diversity to what I'm currently doing.
Very nice. So if someone wants to get in touch with you and know more about what you're doing and what you're planning, how can they reach out?
Probably the best way is on LinkedIn. I do regularly see messages and check in there. And so, Jenna Carl at LinkedIn. Just drop me a message.
I hope people will reach out for help and maybe learn more about what it means to look for help, for mental help. I wish you good luck, and hopefully we'll circle back later on and see how you're doing.
All right. Thank you. Really appreciate it.
Thank you for having
you.
Thank you.
Bye.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.